Botox is a very safe product to use as long as you go to a trained provider who has experience injecting the product. As long as you know how many units for which specific muscle required to get the optimal result, it's a very safe product. Botox is generally a very safe product to use, but there are some contraindications and specific group of patients that should not be getting Botox. One is if you have an active infection. I don't recommend getting Botox injections. If you have any neuromuscular diseases like ALS or myasthenia gravis or any other neuromuscular diseases, it's not recommended to get Botox injections because it'll then weaken that muscle even more potentially. Pregnancy, it's not safe to get Botox in pregnancy. And if you have an allergy to Botox, then you should not be getting Botox. Patients who are also contraindicated to get Botox for, if you're on any specific antibiotics, one group is the aminoglycosides. A group of patients that Botox is not typically recommended for is patients that are on a certain class of antibiotics that are called aminoglycosides. And the reason is the aminoglycosides can potentiate the effect of Botox. What that means is it can actually make the effect a little stronger than it's intended. There's always a risk that you can have kind of asymmetric, uneven results, where the provider is really just kind of guessing. It's not recommended to inject Botox in those patients. Botox generally is a very safe product as long as it's administered by a trained professional who has experience with using Botox. The reason Botox is very safe to use is because, one, it's not a permanent product, so it will eventually wear off, which is one of the good things about it, because if there is an asymmetric result or there is a suboptimal result, after a few months the product will wear off. It's not a permanent change to the face.